enthusiast of healthcare innovation. I'm Alma and my team member is Roshna. We are from CT School of Management. It's an honor and privilege to stand before you to delve in the topic of utmost significance, that is One Health approach, advancing human-centric and sustainable development in healthcare. So now let's start our presentation.
So good afternoon everyone. Today I am thrilled to discuss about the One Healthcare and its pivotal role in advancing human-centric and sustainable development in healthcare. Now let's discuss about One Health approach. So One Health approach, it is a holistic strategy that recognizes the interconnectedness of human health, animal health and environmental health. By integrating these three pillars, we could able to generate numerous advantages in the human-centric and sustainable development in the healthcare industry. Now let's discuss some scenarios. The ecosystem health. So changes in one aspect of the ecosystem can cause a numerous impact in human health, for example in case of a deforestation. Then let's discuss about the zoonotic diseases. So these are the diseases that are caused by infectious diseases like COVID-19 that are caused by pathogens. So these are mainly caused by animals. As a result, these will impact human health. Then food system. So deteriorating in the quality of food crops as well as the livestock can affect human health. Then antibiotic resistance. So misuse in healthcare as well as agriculture breed resistance to bacteria. Then biodiversity loss. Due to the disruptions in the vital ecosystems, threatening to human as well as animal health. Then climatic changes. So sudden changes or alters in the ecosystem, weather patterns as well as the habitats, posing a huge health risk. Due to these scenarios or due to these problems, we need to implement One Health approach. By integrating One Health approach, we will able to integrate human health, animal health as well as environmental health, thereby developing a holistic solution.
Now let's look at what are zoonotic diseases. So zoonotic diseases are diseases or the illness caused by pathogens that are such as bacteria, virus, parasite, fungi that can be transmitted between humans and animals. So let's look at how does this One Health approach address them. By early detection and surveillance, understanding disease dynamics, integrated response across sectors, promotion of responsible practices, research and innovation for prevention and control. So this One Health approach to promote environmental sustainability and enhance food security focuses on sustainable agricultural practices, conservation of natural resources, climate resilient strategies, access to nutritious food for all, and strengthening local food system.
As I mentioned earlier, that One Health approach, it is an holistic strategy that interconnect human health, animal health as well as environmental health. Thus we can see that we live in our globalized world because we all are independent, because we all share one world, because we all share one health.
So now let's see the advantages of One Health approach. So it helps in sustainable environment management. The One Health promotes sustainable environment practices by addressing factors such as climatic changes, habitat distractions, and the pollution that impact human and animal ecosystem health. By addressing health issues at a source and adapting preventive measures, One Health helps to improve public health outcomes. It also fosters an interdisciplinary collaboration between healthcare professionals, veterinarians, policy makers and other stakeholders. One Health approach also promotes a collaborative approach to disease surveillance encompassing human, animal and ecosystem.
Now let's discuss a case study. So during the Ebola virus, that is during the outbreak of Ebola virus in West Africa during 2014, One Health approach played a crucial role in controlling the epidemic as well as promoting in a sustainable manner. By adopting of One Health approach, the health organization able to collaborate with environmental scientists as well as veterinarians in order to identify the animal reservoir of the virus to prevent future outbreaks, and also implementing of a community-based surveillance program to detect early signs of disease transmissions, and also educate communities on safe burial practices as well as hygienic measures. Then addressing environmental factors contributing to disease spread such as deforestation and population displacement. Then enhancing of healthcare infrastructure to provide prompt diagnosis and health treatment.
So now let's see a hypothetical statistical data showcasing the impact of implementing One Health approach. So as you can see, there is a drastic increase in healthcare utilization, livestock vaccination cover, foodborne illness cases, and there is a decrease in environment contamination, economic cost of disease outbreak, incidence of zoonotic disease, and antibiotic usage.
Now let's discuss about the challenges and opportunities. So challenges that are faced by adopting of One Health approach. So siloed healthcare system. So siloed refers to the boundaries or the mindset that prevail between or within the healthcare organizations. So due to these siloed healthcare systems, there are gaps between various sectors like the environmental healthcare as well as the veterinarians. Then limited resources. Even now there are limited in resources due to shortage of fund, infrastructure facilities as well as trained professionals. Then coordination and communication. Due to the siloed mindset that prevail within the healthcare organizations, there is a gap between various sectors, mainly the healthcare professionals, veterinarians, as well as the environmental scientists. Then regulatory barriers. Even now, each sectors have their own rules and regulations pertaining to them. So due to these gap between the each sectors, the rules also need to be adjusted with them. Then now let's discuss about the opportunities. So sustainable practices. By adopting One Health approach, we could able to generate a sustainable practices such as waste management systems and conserving our energy. Improved public health outcomes. By identifying the root causes for these various diseases, we could able to control the spreading of future outbreak of these diseases. Then enhancing disease surveillance. So One Health approach able to implement a systematic surveillance program so that we could able to monitor them before they outbreak. Then community engagement. So One Health approach generate a community engagement program so that we could able to integrate various aspects together and develop a one systematic manner.
So now let's see the role of healthcare institutions in integrating One Health principles into policies and practices. So in policy development, the healthcare institutions can work with policy makers to develop and implement policies that promote One Health. It facilitates collaboration between different sectors such as human health, animal health, and environmental health. By collecting and sharing of the disease data, environmental trends by the healthcare institutions, it helps to identify emerging threats, etc. Training healthcare professionals helps to develop curriculum, continuing education, and thereby clinical training.
So, based on our study, we recommend to follow those actions to promoting of One Healthcare. So, integrations of One Health principles in education. So, we need to encourage our healthcare organization in order to adopt One Health principles into their education curriculum. Then, promotion of interdisciplinary collaboration. So, health organization need to collaborate with various fields such as researchers, students, and professionals. Then support for research and innovations. So the healthcare organization need to provide support for further research and development in the field of One Health approach. Then comes the advocacy for policy change. As I mentioned earlier that the limitations regarding One Health is that the policy pertaining each sectors. So there is a need for changing of the policies so that we could able to implement the policy in a local, global as well as a national level. Then community engagement and outreach. So, by adopting a One Healthcare approach, the communities are able to integrate themselves and thereby developing in a sustainable manner.
So now let's conclude our topic. From the above discussion, it can be said that One Health approach promotes collaboration between human health, animal health, and environmental health. It emphasizes holistic strategies to prevent diseases, ensure sustainable development, enhance global health security, and thereby recognizing the interconnectedness of all living organisms. Thank you.